Hi, India?
Yes.
Hi.
Hi.
How's it going today?
I'm well. How are you?
I'm doing well. Thank you for asking. It's very nice to meet you. My name is Dr. Perez.
Nice to meet you as well.
Welcome to the office. I know you are a first-time patient here at the clinic, so I appreciate you for coming in.
Thank you.
It looks like you were referred by your primary care physician with a recent diagnosis of type 2 diabetes?
Yes.
Okay. So I did see that the reason you were diagnosed, it looks like you've been experiencing some kind of peripheral loss of sensation in your feet. Is that correct?
Yeah.
Okay. So let me just go ahead and make a note of that. Is that something that you've noticed in both of your feet, or is it one that's more so than the other?
I'm noticing in both.
In both. Okay. Okay. And with that, have you noticed that you're experiencing any abnormalities in temperature? So do you feel like your toes specifically are colder than the rest of your feet or the rest of your legs?
Yes.
Yeah, okay. So that is something that I see, unfortunately, in patients that have uncontrolled diabetes and that have been uncontrolled for some time. So I would guess that your diagnosis is probably a little bit of late onset, given that the temperature abnormalities and lack or loss of sensation don't typically tend to come about for quite a while that you've been undiagnosed. So I would guess that your blood sugars have probably been unregulated for a while. Have you seen an endocrinologist yet, a specialist that would help you as far as your insulin balance? Are they giving you medication for that? Do you take insulin now?
Yes.
You do, okay. And is that just the standard like Novolog injection?
Yes.
Okay. Very good. Do you find that any of your symptoms have mitigated slightly since you've been taking insulin, or do you feel like it's about the same?
It's about the same.
Okay. So aside from that, are you having any other adverse symptoms today as far as difficulty walking or discomfort in your feet or any pain anywhere?
No pain.
Okay. Do you typically wear open or closed-toed shoes?
Closed.
Closed. Very good. So I will be having an inspection of the shoes that you brought in with you today. Just would like to see what you wear on like a day-to-day basis.
Okay.
So just taking a couple of notes here, a couple things that I want to make sure I don't forget when we begin with your examination.
Okay.
Look at your feet overall and see if there's anything I notice externally that I think is concerning. So I'm not noting any swelling right off the bat, so I am able to see your bony prominences appropriately. It does appear as if you have a birthmark here. So visualizing the plantar and plantar fascia, I'm not noting any openings of the skin or any abnormalities in skin texture, so that's good. Also, I'm not noting any odor or any signs of fungal infection, which is great. Okay. All right, so let's go ahead and get started with your examination. So I'm actually going to begin by having a look at your shoes. These are the shoes that you brought with you today, and these are very good walking shoes. New Balance is actually a brand that I typically recommend to my patients because it offers adequate support. So just inspecting the shoe overall, looking for any abnormal signs of wear and tear. Anything that it could indicate like a wasting of the foot or an atrophy of the muscle of the foot. Be indicated by an abnormal wear pattern on the bottom of the shoe. And that does appear fairly even, so I'm not noting any signs of atrophy there. These shoes do appear fairly new. The tread is still intact. How long have you had these?
About a month or two.
About a month. Okay, so so they are fairly new. So definitely would recommend that you keep up with footwear. I typically tell my patients that if you are an average daily walker, you're getting anywhere from 3 to about 7,000 steps. You should be changing your shoes out every 6 months to a year. So every 6 to 12 months, you probably need a new pair of sneakers. If you are more physically active, then we're looking more about every 3 or 4 months. Okay. So proper footwear is essential. Specifically in my type 2 diabetic patients, always recommend closed-toed shoes. So I know sometimes we like to wear sandals or open-toe shoes or shoes that expose your feet. Specifically the heel portion or like around the toes, we can become prone to diabetic foot ulcers, which we will discuss. And a good way to prevent that is by wearing closed-toed shoes. Okay. So I'm going to begin by having a look, and I think the first thing I want to do is auscultate with my stethoscope because your feet have been experiencing some temperature abnormalities, so I will be testing for that, but I do just want to listen and see how the circulation is going. Okay. So I'm going to start here. Very good. So just listening to circulation and perfusion, listening for any signs of occlusion or any areas that sound as if they are not circulating your blood properly, which would then lead to that abnormal temperature of the toes. Okay. Very slightly decreased perfusion here at the bottom of the foot, so plantar fascia I would say is slightly diminished. I would say circulation is even bilaterally. I'm not noticing a difference from one side to the other, which is a good sign. And your pedal pulses are intact, so you are getting circulation to the feet. I did notice just a slightly diminished circulation or slightly diminished production of your circulatory system here. So your feet do feel rather cold. So just feeling around with my hands. Just gonna feel slightly up the leg here. It is still rather cold, but there is a bit of warmth there. But as I move down to the foot, they are rather cold. Okay. Do you find that you experience these abnormalities in temperature even in the summertime when the rest of your body feels warm? Or are your feet still cold?
Yeah, sometimes.
Okay. So luckily I'm not feeling any differences between the feet. So if I was feeling either warmth or abnormal coldness from one side to the other, we could be looking at something like DVT or deep vein thrombosis, which is like an occlusion or a blood clot, which I'm not feeling, so that's a good sign. Both of your feet, however, are very cold. So I'm going to go ahead and test with my thermometer gun as well. So this is just going to allow me to obtain a base temperature here. So I'm going to start by testing a warmer area. So I would say that we are finding an abnormal reading here. The lowest I'm getting is 89.6, and ideally temperature ranges from about 96.4 and above. So we are a little bit low here. Okay, so temperature is just a little bit abnormal for sure. So I'm just going to take a quick note there. Semi-normal auscultation. Diminished circulation throughout. Plantar fascia slightly abnormal. The dorsal portion of the foot was also abnormally cold. Okay, so moving on, we are going to continue with our examination. Now, I just have a visual inspection of the foot itself. So, just having a look with my Penlight, specifically looking at the bony prominences, such as the ankle, as well as on the outside. Okay. So, having a look at the dorsal region of the foot, looking for any signs of edema. So typically the top of the foot is where we would see an excess of swelling or retention of fluid, which I'm not noting here. I am just going to palpate for any possible pitted edema, but I'm not seeing that, so that's a very good sign. Having a look at the toes, you do have your nails painted. I'm going to have a brief look in between the toes. So looking at the skin in between the toes allows me to check for any possible diabetic foot ulcers that could be hiding. So it is very important that you check between your toes frequently. I would say at least on a daily basis. You want to be just having a look in between to make sure you're not missing any open areas. And then, of course, adequate hygiene of the feet is very important. So your feet appear very well groomed. Overall, not noting any callus or roughening of the skin, which is very good. Nails are painted and appear clean and well groomed, which is lovely. So, plantar portion of the foot is smooth and not overly calloused, and the heel is intact. I'm not noting any open areas on either side here, so I just want to make sure. Okay, very good. Okay, so I'm going to check for circulation, or what's known as capillary refill. So I'm just going to be pressing down on the toes, and because your nails are painted, I will be using the bottom of your foot to just check for circulation. So just holding down here for a few seconds. And I am getting a slightly diminished response there. Okay, so your circulation in your toes is definitely diminished. As I release pressure here, I'm not getting a typical +2 response, which means that your blood is not continuing to circulate within a 2-second time frame. So I'm just going to move on to check the mobility of your joints. So I'm just going to manipulate your feet slightly. If any of this causes you any pain, just let me know. So essentially just checking for any abnormal rigidity of the joint. So moving the toes individually. Okay, so joint mobility does appear to be intact. I'm not noticing any excess rigidity here. Good flexibility. I'm also going to mobilize the ankles, so just allow me to manipulate your foot. Are you able to wiggle your toes for me? Very good. And can you scrunch your feet tight and spread your toes out as far as you can? Good. Can you push against my feet? Good. Pull back towards you. Very good. Any pain or discomfort there? Perfect. Okay. Good. So mobility and flexibility is intact. Perform a couple percussions here. So I have a reflex hammer that I'll be using to percuss along your bony prominences. Just looking for that natural movement there. Yeah, great. Very good. Okay, so I'm just going to do a brief measuring, checking for symmetry between the feet. So essentially just using my calipers to measure at the widest portion of the foot bilaterally. And then the narrowest portion of the foot here. It's about even as the heel is. Good. So I'm going to measure the bony prominences here. So I'm measuring at the anterior and anterior ankle bone. Very good. And then, of course, just measuring the length of the feet. Is roughly the same. Very good. So there are seemingly no differences in the size of your feet. Some people actually do have 2 different size feet. So just taking a couple more measurements here. About 8 3/4. About 8 3/4. Okay, so feet are pretty symmetrical throughout, which is good news. Just gonna catch up on a couple of notes. Okay. Do you ever get any pain or discomfort discomfort in the bottom of your foot, specifically in the heel?
No.
No. Okay. No pain. So moving on to testing for temperature variation. Now, this is probably going to be the most significant portion of our examination, given that you are experiencing some numbness. Can you describe it to me just slightly? When you feel numb, is that what you would consider a lack of sensation or just a loss of sensation? Can you still feel things, but maybe not as prominently as you feel elsewhere?
Mm-hmm.
Or do you feel you're not feeling anything at all?
It's like a loss of sensation.
Okay.
I feel it in some areas, and in some areas I don't feel it at all.
Okay. Any tingling or like pins and needles, or the feeling like when your limbs fall asleep and are waking back up and it's kind of tingling?
Sometimes.
Sometimes. Okay. And that's in both feet as well?
Mm-hmm.
Okay, so just a test for basic tactile sensation. Can you feel me touching you here?
Yes.
You feel me touching you here?
Mm-hmm.
You feel me touching all of your toes?
Mm-hmm.
And do you feel me touching you here?
Yeah.
Okay, good. So you are able to feel. Okay. I'm going to start by testing a couple different stimuli here. So I have two tools that are virtually identical. They are both very soft. I'm going to touch you with them just like this. I'd like you to say yes when you feel me touch you, okay?
Yes. Yes. Yes.
Feel this here. Okay. You feel this here? No? Okay. Here?
Yes.
Okay. Here?
Yes.
Yes. Okay. Here? No?
No.
Okay. Do you feel it at all on the bottom of your foot?
No.
No? And on this side?
Yes.
You do feel it on the side.
Mm-hmm.
You feel it, all of it here?
No.
Here? Oh, here?
Yes.
Yes. But not here.
Mm-mm.
Okay. So I'm going to bring this down. I want you to tell me if it feels the same on both sides. So can you feel this here?
Mm-hmm.
Does this feel the same on both sides?
Yes.
And this feels the same?
Yes.
All of this feels the same?
Yes.
Okay. Now, does this feel the same?
Yes, kinda.
Kind of. What felt different about it? Did you feel it more on this side?
Yes.
Okay. Does this feel the same?
Yes.
And does this feel the same?
Slightly.
Slightly more on this side again?
Mm-hmm.
Okay. Same thing here. Does this feel the same?
Yes.
Here?
Yes.
Here?
Yes.
Here?
Yes.
Good. Here?
Yes.
Good.
Yes.
Good.
Yes.
Good. Okay. Hold response is intact. Okay, so this time I'm going to test for sharper dull variance. So I'm going to touch you with two different things. Can you feel that this is soft?
Yes.
And that this is sharper?
Yes.
Okay. So I'd like you to indicate whether or not you feel soft or sharp.
Okay. Sharp. 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 Soft. Soft. Sharp. Soft. Soft. Sharp. Soft.
Does this feel the same as this?
Yes.
And this here feels the same as this?
Yes.
Okay, good. So you did better with that. I'm going to test one more sharp sensation. This object is very, very sharp, so I will be just gently touching you with it. This time I'd like you to let me know if it feels any less sharp. So now we're testing for numbness isolation. So I kind of want to figure out what parts of your foot are feeling more numb than others. So for example, if I run this across the dorsal portion of your foot here laterally, does this feel any less sharp anywhere there? Or does it feel about the same?
It feels less sharp at the top.
Less sharp here.
Yeah.
Okay. And anywhere here feel less sharp?
Yes, at the top.
At the top, okay. And here?
At the top.
And here?
No, that's no different.
No difference. Okay. So if I come in this way, does it feel less sharp as I come up here?
Mm-hmm.
Middle as well?
Yes.
Okay. So same thing on this side. Does this feel any less sharp anywhere?
No.
In here?
Less sharp at the bottom.
Less sharp at the bottom?
Mm-hmm.
Okay. In here?
Less sharp at the top.
In here.
Same.
Any difference here?
No.
Here?
No.
And here?
No.
Does this sharpness feel the same as this sharpness here?
No.
No? Which side feels sharper?
The left side.
Left side. I'm going to go ahead and test for Babinski reflex. So essentially testing for neurological function, we have a natural reflex in the bottom of our foot. So when activated, your foot should move. Essentially, I'm going to trace the bottom of your foot with this object. I'd like you to just allow yourself to react naturally, okay? Mild response. Okay. So definitely not getting quite as prominent of a response as I would like. Okay, so your right side does appear to be experiencing some neurological dysfunction in that your sensory components are not intact, as well as your Babinski was slightly abnormal here. I would say the left side is also diminished, but not quite as severely as the right side. Alright, India, I would say that will conclude our diabetic foot inspection today. I am going to go ahead and take some notes after you leave. I would say there were several components of your examination that I am concerned about, unfortunately. Give me just 1 second. Stay on the right side. Delayed, and the left side partially delayed. Definitely a diminished response to Babinski. Tactile sensation is lacking in some areas. Definitely a loss of sensation. The plantar region of the foot on the right side. Loss of sensation as well too. Cold response. Sharp sensation is intact, which is good. However, soft sensation is definitely Unfortunately, sensation loss tends to be gradual over time. So typically once we start to see that you're having some of that periphery loss, it tends to kind of go downhill from there, so to speak. So then you start to lose sensation as a whole, and then we get into bigger issues. You're at a higher risk for diabetic foot ulcers, as well as amputation and that kind of thing. Okay, so it is something that we do take very seriously. Our feet obviously are the stability of our body. They're what keep us moving and keep us walking. And unfortunately, your body treats your mid portion as the kind of home. So that's where all your blood circulation goes, and your feet kind of get the last leg of whatever blood you have left in your body. So these are all things that these specialists can discuss with you and kind of educate you a little bit on, so that we can help better control your blood sugar through means of nutrition. Okay?
Okay.
So moving forward, I would like you to continue, of course, with your foot hygiene, wearing your closed-toed shoes. I will get you referred to those specialists. All of that information will be made available in your patient portal. Okay?
Okay.
So I would say give me anywhere from 48 to 72 hours. You should see 2 or 3 referrals in there. You can contact them at your leisure and make appointments accordingly.
Okay.
Okay? Okay. All right, India. Well, thank you so much. I don't want you to worry too much. It's good that you came in for your appointment today and that we're staying on top of it. Very important, though, that you follow up with those specialists, okay?
Okay.
Okay. All right. Thank you very much. I'll give you a couple minutes to gather your belongings. You get home safely.
Okay.
Okay. Thank you.